Away from security to health matters, as the world marked World Polio Day 2025, health professionals in Adamawa State have joined the global call to sustain the fight against polio, calling for a renewed commitment to protect every child from the disease. The event, marked by a symbolic road walk across major streets in Yola, the Adamawa State capital, drew health officials and development partners as they emphasized the importance of vaccination and vigilance in keeping Nigerian polio free. The World Health Organization Regional Director for Africa, Dr. Mohamed Janabi, in a written address, praised Africa's progress toward a continent free of polio. And also, the Adamawa State Ministry of Health, representatives from the WHO, and health workers emphasized that the state remains committed to protecting its children through continuous routine immunization and prompt response to any health alerts.
Ending polio in Africa is about more than halting transmission. It means strengthening the system, workforce, and networks that sustain immunization, outbreak preparedness, and resilient health services. The task ahead demands continued commitment, adequate financing, and coordinated action at every level. On this World Polio Day, let us renew our determination to reach every child with every vaccine, everywhere, and to consign polio to history forever.
And joining me now is a consultant public health physician, Professor Alera Roberts. She joins me virtually. Good to have you join us.
Thank you for having me. How are you?
Very well, thank you so much. Professor Roberts, the theme for this year is End Polio, every child, every vaccine, everywhere. But just looking at that, we know there are a lot of controversies when it comes to the vaccine. How close are we to achieving this?
Honestly, we're closer than we ever were in history, with only the wild polio virus being circulating in 3 countries, Pakistan, Afghanistan, and of course Nigeria. But we've had our polio-free certification since 2020, and this is a major victory for us. But we have to realize our task is not finished. We still see outbreaks of the circulating vaccine-derived polio virus, particularly in the cross-border states in the north, and this is where we need to put in a lot of work.
And Professor Roberts, one of the greatest challenges to polio eradication is the vaccine misinformation and conspiracy theories, and even from global organizations and leaders. How can we tackle this in a way that encourages parents to get their children immunized?
It's unfortunate, but the truth of the matter is that this the vaccine hesitancy will exist for as long as there's misinformation, and for as long as there's no trust in public agencies and public systems. So we must first rebuild that trust, literally person by person, community by community, through health workers, through the traditional leaders, through faith institutions. We must all work together to make sure we become the trusted messengers that can speak the language and the values of the people that we serve. Because until we have that trust, there's always going to be that fear. We need to be able to respond to people's fears with empathy, answering their questions, addressing their concerns. Like I tell my students in the class, there is no stupid question. The only stupid question is the question you did not ask. So no matter what they are asking, no matter what their fears and concerns are, we must respond. Very often you find that people are not anti-vaccine as such. They're being cautious. And this is something we have to realize, that science must develop a human face.
Interesting you mentioned that, and that's a takeaway for me. Science must develop a human face, especially when you look at what happened during the COVID-19 pandemic, where there were a lot of questions, but without answers from the vaccine developers. And I'm just wondering, again, WHO has been robbed of poorly by the COVID-19 pandemic, and I'm wondering how it fits in now into this particular, the eradication of polio, as well as UNICEF, and how they can continue to support Nigeria's post-eradication surveillance.
To be honest, there are three things that we need. We first need strong surveillance systems. We've got a strong surveillance system. We must not rest on our oars. We must give kudos to the NFLT, the Nigerian Field Epidemiology and Laboratory Training Program, that has been training the professionals that have been maintaining it. But it needs to be supported every which way. We need to retain, we need to remunerate, we need to continue training. The other thing is, of course, that segues into health worker training and logistics. We must provide fast and furious health worker training and logistics. We must realize that our greatest asset in keeping this polio-free eradication is going to be healthcare professionals, everybody. And of course, we now need to integrate what we call polio assets, community mobilizers. We need to have a cold chain that works. And that means, in all its entirety, people to actually keep the vaccines frozen and transport them from storage to use to the point where they're used. We need data networks. So again, we need to keep talking to the telecoms people that they need to provide those data networks and make sure they're working. And then we need to have what we call a broader integration into routine immunization. That integration will continue to protect the gains we've made and to strengthen our entire primary healthcare system.
And we hope that the immunization process also wears a familiar face, so that faces that people can trust and listen to. Thank you so much for your time. A consultant public health physician, Professor Alera Roberts, always a pleasure to have you on. Thank you.